The Psychology of Life. Health and Wellness Show. With Dr. Scott Anderson.
Well, good afternoon. My name is Dr. Anderson. I have a PhD, board certified in addiction, also a licensed psychotherapist. I'll be presenting your information today. The reason why we set this up and do these videos is so that people have access to substance abuse and mental health information, education, and treatment who cannot afford it or don't have it readily accessible to them. So we provide this as a public service to help folks out to get in the right direction and to get help if they can't afford it or don't have access to it. So glad you guys will be participating in it. If you have questions, feel free to ask. Basically, I'm doing some information about what the process is for substance abuse and mental health. Then we'll go into our treatment materials that we're going to discuss today so I can orient everybody. But I wanted to cover something because a lot of times I think people get confused as to what's the process to go through to get help with substance abuse and mental health. It's a very difficult road if you don't know how to navigate it, one. For two, there's a lot of stigmas to it. Stigma is a bad association with substance abuse and mental health. So oftentimes people that are suffering with mental health, depression, anxiety, panic attacks, codependence, poor relationships, personality issues, those are the most generalized ones, don't seek help for it. They suffer in silence. They're quietly miserable. And that's no way to live life. So I want to give information that's going to help people get past those stigmas and have a pathway to get yourself into a better position, to get better, to be well again. And that's the ultimate goal, is mental stability, physical stability, prosperity, happiness. When everybody strives for that, society will get better quickly. And that's what I'm looking for. That's what I want. What are some of the stigmas? Those are self-evident. With mental health and substance abuse, there's shame and guilt associated with that, which further drives that person deeper into depression, anxiety, self-esteem issues, what have you. What to do? Well, there's not a whole lot of information out there. That's why we're putting this out there. First thing is try to educate yourself. Go on the internet and look up whatever it is you feel that you're going through. If it's depression, anxiety, most people know the symptoms of those things. So try to find out kind of where you're at. Once people figure out, well, I think I'm depressed, or I have anxiety, or I have panic attacks, or I'm going through this, or I'm in a codependent relationship, or toxicity in my relationships, then what to do about it? That's the hard part. So figuring out that you're miserable and that you have a lot of symptoms of issues that need to be treated and getting help for that are two separate things. And so we're going to help with the second part, the latter. What do you do? Well, there are places in Florida, and I'll speak to Florida because I'm familiar with it. We have a place called the Crisis Center of Tampa. If you are calling from Tampa, you just dial 211, or it's 964-1964. And that's the phone number to the Crisis Center. What they do is they're a database of information about all the facilities, help, assistance, places you can go, and they have information about that. So if you have a loved one or someone that's suffering that needs help, maybe residential treatment, outpatient, drug maintenance or prescription medication maintenance, all that other good stuff, they'll help you for the placement part, okay? So in each state, there's a database like that. There's an agency or facility. So look it up in whatever state it is, and just look for substance abuse database or assistance, and generally you'll find several, okay? But they do have one in just about every state, okay? So first thing is to try to access that as a resource. Second thing is, what is the process? Well, I'm going to tell you. That's what this whole thing is about. Let's say somebody is at an age, let's say they're 23, 24, and they start to realize, hey, you know what? I've always had a little depression, little anxiety, but now it's getting to the point where it's affecting my capacity to function. Work, school, relationships, physical health. What do I do? What's the process? And that's where people kind of get stuck because they don't know what to do. So they don't do anything. Basically, here's the process. If you start to feel that, the first line of defense would be to speak to friends, family for support, just to get some support, to get a feeling of comfort and stability. Second thing is reach out to a professional. There's counselors, there's therapists, there's licensed mental health counselors and licensed psychotherapists, same thing. There's psychologists and there's psychiatrists. Counselors are for mild, everyday problem solving. Maybe you just have poor coping skills, but you're not clinically depressed. You're not diagnosably depressed. You're just depressed. You have difficulty dealing with stuff. You can seek counsel. In church, in support systems, there's a lot of that. You can find those all over the place, seeking out counselors, school counselors, what have you. And they'll give you advice based upon their experience and their training, okay? If that isn't resolved or doesn't fix the problem, then would be the next step where you have significant depression, anxiety, panic, toxicity in relationships, codependence, those types of things. Then you would seek out a LMHC or an LCSW, basically a licensed therapist. Okay? They're trained to help with people and diagnose people with substance abuse, mental health issues, and assist them in resolving those, okay, through a pathway of therapy and individual talk and utilization of collateral resources. If there's substance abuse, which there often is with mental health, because people like to self-medicate for anxiety, insecurity, depression. So they'll use alcohol or drugs as a form of escape. That's different. You don't want to go just to a mental health counselor because they don't have an area of expertise in addiction. They're going to cover the mental health issue. So dual diagnosis, you would need a specialist, a board certified addictionologist, or a board-certified addiction expert or addiction professional, okay? They're specifically trained, not just in mental health, but substance abuse and the dual diagnosis, okay? That's really important, okay? I would never send somebody with addiction and depression to just a mental health counselor, because not that they wouldn't be helpful to some degree, but they don't have the area of expertise in board certification or licensure in that area. They have it in mental health. So it's a little different. Does that make sense? And they may be lacking in those areas. So you have to make sure that you're aware of that. So this information is important to know that there are licensed people, therapists out there, and psychologists that are specific to an area. And you can look those up. A good resource to go to is Psychology Today online, and you can type in a specific treatment like substance abuse and mental health, and then it'll come up with categorizations, and then you can go through and see the individuals, what they're licensed in and what their experience is. So educate yourself with that. Try to get information about that. But there's plenty on the internet that you can find. Okay? A psychologist, that is a PhD level, somebody specifically trained to deal with, again, the mental health and substance abuse, the mental health issues, okay? Again, a psychologist, mostly, they do testing, evaluation, assessment, writing letters. Typically, generally speaking, they're more in institutions of bureaucracy. Now, that doesn't mean there aren't psychologists out there in private practice that could be helpful. I'm saying in general, the training and education for that is more of a clinical assessment, evaluator, writing letters, doing testing and assessment. Okay? So ideally for for mental health, you would want a licensed mental health counselor. For substance abuse, you would want somebody board certified in addiction, but also an LMHC, a licensed mental health counselor. So a licensed counselor or therapist, I should say, not a counselor, a licensed therapist with board certification in addiction, okay, at minimum. Now, psychiatrists. What do psychiatrists do? How are they different than psychologists? Well, psychiatrists are in the business of giving you drugs to deal with symptoms of depression, anxiety, what have you. Rarely, and again, I'm speaking in generalities because they're mostly true, do they worry about the backstory or the underlying causes. They just treat the symptoms through psychotropic medications or benzodiazepines, opiates, what have you. Okay? I'm not a big fan of that. I'm more of a fan of using a mental health therapist or a psychologist to get to the underlying root or cause of the problem. Because that's the ultimate goal, is to get to the root of the cause and resolve that. And then what will happen to the symptoms? They dissipate and go away, and problem solved. So that's what we want to do. Psychiatrists aren't interested in that. They're more about writing scripts for drugs. I don't call them medication, because medication, there's a delineation that I discern. The delineation I discern between medication and drugs is the medication fixes and resolves the underlying issue. For example, antibiotics. If I have a bacterial infection and I take antibiotics, it will cure, fix, and resolve the problem. Okay? If I take a pain medication to deal with an infection, it may relieve the symptoms and make me feel better, but it doesn't solve the problem. No. So the problem can get worse even though you feel better. Do you understand? And that I have a problem with, because you're not addressing the actual cause and resolving it. Okay? So that's the difference. So understand that different treatments for different things have protocols. Okay? But it's always best to deal with the underlying causes to things rather than just the symptoms. Everybody got that? So everybody kind of clear on what level? So mental health counseling for depression, anxiety, those things, a licensed therapist. If you needed a clinical evaluation, let's say of your son because of behavioral disorders in school or issues of depression, anxiety, and so then you can go to a psychologist. They'll do an evaluation, an assessment, a clinical testing, and then they can do placement or help in that way. Okay? A psychiatrist, again, I'm not a big fan because psychiatry is more drug dispensaries. Not all, but the vast majority. And unfortunately, that's not helpful long-term. It's helpful short-term, and it has its place to some degree. But long-term resolve of the actual problem doesn't happen in that setting. Okay? So do you understand? And counselors are just for general, garden variety, difficulties dealing with stuff, adjustment disorders, not otherwise specified. Where you have difficulty getting over something, you go to see a counselor or a clergy or a priest or a counselor for the church or community counselor. And they can help you, they can assist you, they can help support you and guide you in that way. All right? Do you understand the different varying levels? Treatment. This is the other part that people get really confused about. I get calls all the time. If somebody has addiction, let's speak to addiction, because rarely would you be hospitalized unless you have schizoaffective disorder, schizophrenia, or those types of disorders. But for substance abuse, there has to be medical stabilization physically, along with the support and counseling for the treatment part. So people, when they have relatives and they've reached a point where that person is losing their job, they're doing dangerous stuff, they're harm to themselves or others, the parents or the family members reach out and they say, well, what can we do? I don't know what to do. Who do we call? Because you can't just call the police unless that person's a harm to themselves or others. There's a thing called in the Marchman Act. And in the Marchman Act is where that person is exhibiting behaviors that are dangerous to themselves or others, and you go to the courts and you fill out some paperwork and you can go to the courthouse, and that's where you would get that paperwork and ask for assistance. There's an area there where you ask for that, for an Marchman Act, and they would help you, assist you with the filling out or the documentation part, and then you have to fill that out, where you and several family members kind of write out what's going on, what brings you to that conclusion that this person is a harm to themselves or others, and then that gets passed off to the judge, and the judge can make a court order for that person to have to go somewhere to be evaluated, assessed, and treated. Okay? And then that can start the ball rolling. Most people get better from substance abuse when they're forced into doing it. Rarely will they do it on their own accord. It usually takes a DUI, probation, or jail, or that type of interaction with legal in the court system in order for that person to kind of get a little wake-up call and be forced into sobriety, which then starts them on the path to getting treatment. Yes, sir.
Is that in all the states, that act?
Yes. Yes, it is. It's called a Marchman Act. I don't know how to spell it. All right. And then there's a BA 52, which is called a Baker Act. There's another one too, a BA 15, I think, and a BA 52, or BA 32 and BA 52. That's where somebody's is exhibiting dangerous-like behavior in public and to other people. You call the police confront that person is incoherent or unable to use reality and good decision making, they're out of control. The police will take them in and bring them to a receiving facility, which is an inpatient hospital, like I said, the crisis center here in Florida, where they would be evaluated and assessed, and the doctor would have 72 hours, can hold them for up to 72 hours to assess whether they're a harm to themselves or others. Usually when that person sobers up over that 48 hours up to 72 hours, they go back to reality and they're able to make reasonable, sound decisions, and then they're released. So rarely are they kept. That's where the Marchman Act comes in, because if a person's been Baker Acted several times, you can bring that to court and say, listen, this person's been Baker Acted, they've exhibited these types of behaviors, and then the judge would read that and make a court order. Beyond the Baker Act, the Marchman Act, there's intervention. Interventions, and I used to do these, is where the family members get together and say, listen, our son is out of control, our daughter's out of control. They call an interventionist, an expert in substance abuse and mental health, and what we do is we'll assess, we'll find out the information, we'll talk and have a meeting with the family members so that everybody is aligned and has a universal front. And then we'll have those people kind of write out what's happened, what's the suffering and the cause of damage that this person's done to you, and what is your bottom line? What are you willing to do in order to force this person's hand to getting better? So that may be ultimatums, saying, listen, if you don't get help because you've done this, this, and this, and it's destroyed our relationship, if you don't get help, then here's what I'm going to do. I can't be around you. I can't financially support you. You can't use my car. I'm not going to give you money. I'm not going to do this. And if everybody gets in line and stops enabling that person and allows consequences to happen, that person overwhelmingly, a vast majority of the time, will go somewhere to get help. And once they get clean and sober, once they get over that first 30, 40 days, then they can be reached. Which brings me to the next step. When someone reaches that point, if intervention isn't done and that person reaches a point where they don't need intervention, where the family says, hey, listen, we're concerned, we love you, want to get help. And that person says, yes, I believe I'm out of control, I want help. Ideally, that would be great. Then, depending on what they're doing, and almost always alcohol, benzos, opiates, opioids, partial opiate pills, alcohol, those types of things would require detox and inpatient. When you go to inpatient, you would be detoxed first. Some facilities have detox prior to going in. Some have them while you're in there. There's separate detox where you can go to a detox and not be in residential. And then there's fast withdrawing detoxes. We're not going to get into all of those, but basically, before that person can even start the process of getting better, they have to go through a withdrawal process. That could be dangerous sometimes. And in order for that to happen the right way with minimal risk, they would go to detox, which is inpatient, where they would be given certain types of medications. They would stay for approximately anywhere from 3 to 7 days, and they would be detoxed and then weaned off their medication that helped them get past the withdrawals. Then that person, the appropriate protocol, the ideal protocol, would go into a residential program for at least 30 days. 60 days would be ideal. That's the part that's going to get that person physically stable. See, it's not treatment in the broad sense that you're not getting well or learning what to do or the underlying causes and how to live a lifestyle that's free of alcohol and drugs and to address mental health issues. This is just physical stabilization, because therapy and treatment isn't successful with people that aren't biologically or physiologically stable. So the stabilization, the chemistry in the brain has to be stable in order for that person to think and to be open to getting better and staying sober and dealing with depression, anxiety, family issues, traumas, past events. So that first 30 to 60 days is more of a physical stabilization and allows the neurochemistry in the brain to stabilize to a point where that person now can be successful in therapy treatment. So it would be detox, residential. Once they graduate from residential, now in residential, they do introduce you to the group process where you're going to be talking, you're going to have counsel there, you're going to be meeting with counselors. That's helpful, but it's minimal because you're stabilizing physically. Once that's done, they would discharge you to an outpatient. This is where the magic happens. Okay? Outpatient programs or outpatient treatment facilities basically means that person comes usually, and this is again general information, one time a week for 2 hours, including drug screens. Because outpatient is useless for the treatment of substance abuse if that person isn't sober, if they're using. That negates the whole purpose of the treatment. And unfortunately, many facilities, outpatient, don't care about the actual treatment. They are more caring about getting the money mill rolling. And I hate to say that, but that's the truth. I'm on a provider list, and I can honestly say I'm appalled at what I see in terms of the quality of treatment, doing counseling, and it's terrible. Ideal best practices is one time a week for a minimum of 2 hours. That includes group therapy, lecture education, psychoeducation, and labs. Not a drug screen, not a breathalyzer, actual labs to hold that person accountable. Because drug screen dips are easily beat or adulterated, and blow tests for alcohol are pretty much useless other than within 18 to 20 hours. So labs have to be done to detect an ETG labs for alcohol for up to 7 to 10 days. Okay, that's best practices. Comprehensive outpatient or intensive outpatient would mean that not only do you come one time, you come several times a week. 1 time a week, 2 times a week, up to 3 times a week. So 9 hours, 4 hours, or 2 hours. That's best practice, including the labs. Again, split between psychoeducation, education lecture, wellness education lecture, and group therapy, along with support of individual therapy and family involvement with family therapy as that person progresses in their sobriety and wellness. That's best practice. What percentage of places do that? Probably 5%. We're one of them, and we have unbelievably successful outcomes as a result of that. instead of the rotation mill, like most of the places. So, that being said, that's the process. After that person completes, on average, 10 weeks to 12 weeks of outpatient, and let's say they come in at a more intensive level where they're doing comprehensive outpatient, let's say twice a week, 2 hours and 2 hours plus the labs weekly. And that person starts to progress after generally 4 weeks, then they would be put into the outpatient level 1, which would be 1 time a week for 2 hours plus the labs. So they would transition down. Once that person graduates after about 10 weeks, then they would be put into outpatient aftercare. Aftercare is where you do the individual talk therapy, support, helping with the transition, the lifestyles, and still holding them accountable by doing drug screens. And the drug screens could be periodic or random. That's the protocol. That is best practice. That's going to have your greatest line of success. Here's what generally happens, unfortunately, is most people that have a serious issue, they'll go and they'll be forced, for whatever reason, to go to detox. And they do the detox, get 7 days clean, and then they're out and they're like, I'm all better. Like that magically cleared the addiction. Understand that there's multiple dimensions to addiction. And the physical dependence can be easily beaten within 5-7 days on average for the physical withdrawal, but that doesn't take care of the addiction part. Addiction is psychological, probably about 95% psychological and 5% physical. So once you beat the physical, that doesn't mean you've beaten addiction or the dysfunction that caused it. That just means you're physically stable. So the psychological part is what the outpatient does. And that takes weeks and months to do on average. Because you got to get to the underlying causes. That has to do with family dynamics. And then most of those people are living in a very unhealthy family dynamics or relationships of codependence and dysfunction and so on. So all that has to be stabilized. That's what you do over the course of that 10 to 12 weeks on average. Is stabilize the lifestyle. Remove yourself. Work to resolve, get to the underlying causes, the family dynamics, those issues, childhood traumas, all of that stuff. Plus with the education, how to get into a healthy lifestyle, physically, emotionally, cognitively, spiritually, socially. All of those have to be addressed. So best practices for the type of treatment modality would be a psychodynamic approach, cognitive behavioral, and REBT. Rational emotive behavioral. Then you can address all of those areas. So a multiple disciplinary approach. Most places use a 12-step model, which is dismally unsuccessful most of the time. It's very successful for those people that have more of a superficial or what we call a secondary type addiction. And not that it doesn't have its place and not that it's not helpful to millions of people. I'm saying it's not universally fitted. It's like having one shoe size, a size 8. And yeah, that covers a lot of feet. But what about everybody else? They need the type of treatment that primary we call, which is the outpatient aforementioned. Okay, everybody got that? Okay, so that's very important, all right? The aftercare, again, after you go through the process of working through issues and stuff, then the individual therapy is to kind of hash those things out, finish them up, get closure, move on, help that person transition and support into their new lifestyle, and to keep them accountable with the drug screens.
The Psychology of Life. Psychology of Life. Health and Wellness Show. Health and Wellness Show. With Dr. Scott Anderson. Dr. Scott